But it's been a week of medical drama for the royal family, with Princess Catherine, the Princess of Wales, entering hospital for an operation on her abdomen. She will likely stay in hospital for a couple of weeks and, along with her husband, Prince William, won't be seen in frontline royal duty until after Easter. Meanwhile, King Charles will shortly go into hospital for treatment for an enlarged prostate. Of course, we wish both parties well and a speedy recovery. But Richard Kay, writing in the Daily Mail today, says that Charles's slimmed-down monarchy is coming apart at the seams. When asked about this issue almost a year ago, Princess Anne said it doesn't sound like such a good idea. So, with the monarch, his son and heir, William, and arguably the most charismatic member of the family, Catherine, all out of action, has Princess Anne been proved right? Is Charles paying the price for his slimmed-down monarchy? Discussing this, I'm delighted to welcome political commentator Lin Mei. Lin, great to have you in the studio.
Thank you.
Listen, it seemed like a good idea to slim down the monarchy because the economy's shot to pieces. Everyone is struggling with the cost of living. So for the king to be budget conscious seemed wise. Now I'm having second thoughts.
I don't know. I think when we think of the royals, fulfilling their duties, we think of big events. Now, if I ask anyone on the panel, can you tell me some really big events up until Easter where we really need to see loads of royals attend? Do we know of any?
Well, no, but I suppose you need one, don't you, to open a hospital wing?
Yes, of course. But my thing is this. I don't think as much you're going to get loads of people that absolutely love the royals. I love the royals. I think they're fantastic for Britain. But I don't think that we will notice if the press don't continuously cover, where are the royals? They're in hospital. Oh, no, Andrew's off doing whatever. Harry's doing this. Meghan's doing... It's only because it's perpetuated and pushed in our face that we actually even know that this is a story.
I don't know, though, because, this will be 2 months in which the king will not have his absolute stars, which are the Prince and Princess of Wales, available for the photo shoots to fly the flag for the family. 2 months, that's a long time.
But I think it's a good balance. We're seeing less support, if we're honest, for the royals, even though, like I said, I like them, many people do. But it will show, also it shows the human nature of the royals, for the simple fact that, yes, sometimes humans get sick. Yes, a husband should support his wife in being ill. We all have, maybe not as much as Andrew, but we have a bit of a black sheep of the family.
So do you think William is right to sit this one out until his wife is better?
I wouldn't say entirely, but I would be quite disappointed if I saw him on the front line all the time when you've got a sick wife at home. And I think more husbands, if you know that your wife is not well, you should be there to support her.
Rafe, you've got the stats on how large the sort of active serving royal family was, I think, in 2018.
Yes, when we had the Queen and the Duke of Edinburgh still around, it was up to 18. Of course, what we've had since then, not only have we lost...
18 working royals.
Not since then.
Effectively on
Surely
payroll.
the Duke of Edinburgh was out of action.
Not only had we lost by that point the troublesome trio of Harry, Meghan and Andrew, but since then we've also had the Dukes of Kent and Princess Alexandra retreat, because they're approaching 90 right now. The only minor working roles left are the Duke and Duchess of Gloucester, but they're approaching 80 as well. So anyway, the streamlined monarchy the king wanted was of 10 people. It's now down to 7 because of the departure of the troublesome trio, and it's now actually down to 4 temporarily whilst we have the Prince and Princess of Wales and the king out of action. And whilst that's just a temporary absence, it actually gives us a sight of the future, because as the older generation get older, there's more likelihood that they're going to have more health ailments afflicting them. Now, there's a light at the end of the horizon here, because, of course, the 3 young children of William will come of age in about 15 years. But then the king's going to be 90, the Queen will be 91, and Princess Anne will be 88. So they won't actually be fleshing out the monarchy. They'll just be filling up the gaps left by the senior royals.
It's just like the Manchester United squad, isn't it? It's aging.
I was thinking that myself,
and
yes.
not enough stars.
Not enough stars and not enough defenders. I'm not a great monarchist, but I do think it's quite important to have a good supply of them for these events, because they're great morale boosters. I saw Sophie doing the opening of the medical school at the University of Kent a few months ago. She made a tremendous speech. you know, and everybody felt great afterwards. But I mean, some of that will have to be postponed, won't it? Openings that, I mean, they're never really literally the opening, are they? They're always the symbolic opening.
Yeah.
So some of the actual events will have to be postponed.
I think it's good,
and if they
though.
can get the numbers back up, then great.
Yeah, I think it's good that I'm happy that King Charles has scaled back because it reflects the tone of the country. We're facing economic crisis and to have, you know, loads of royals. I know you said it boosts morale, but some people also find it quite distasteful to have so many working royals when the country is struggling and they're essentially, you know, I know they bring in loads through tourism, but they aren't cheap.
No, and actually back in 2018...
There are ways of cutting back their expense, surely.
Also,
Yeah.
Just like there are for journalists.
Back in the day,
But I have to interject because the monarchy plays a fundamentally important role as a symbol of national unity and identity and social cohesion. So we need to have members of the royal family across the breadth of this country opening schools and hospitals.
Does everyone feel like that?
Community centres, because people engage with it in a way. It's one of the few institutions left in our country that actually helps to unite us as a people. And I think it's to the detriment. And also remember, there are over 1,600 patronages that the royal family have had to scale back on. Now, these are issues and causes that are unsexy, and the media would never cover issues like this unless the royal family bring attention to them. And also the unsung heroes, the soup kitchens, St John's Ambulance, the Girl Guides. The monarchy is a supreme champion of civic duty, volunteerism and philanthropy. And having a reduced... The monarchy must be seen to be doing good. And I just fear that slimming it down will limit that.
Let me ask you this. In the news, and it's extremely sad that either of them have had to go to hospital, and I hope that they have a speedy recovery. But we have had so many headlines that are crucial. We've had a little boy who passed away next to his father. We've had the Rwanda bill. We've had war in the Middle East. And what's dominated our headlines is, you know, King Charles having his prostate reduced, some work done on that. And we've also had Princess Catherine, who's had a successful, by the sounds of it, abdominal surgery. Should that be dominating whether they're key issues that we should be looking at?
Increasing awareness about enlarged prostates, definitely, because that's one of the great things that's come out of this is the number of people who are now looking 11 times an increase in the number of searches about prostate, which is very good. But your issue is a relevant one. Take it up with the red tops and the tabloids because it's not the royal family
Agree.
putting that out.
all right, well, this one is going to run and run.